This healthcare issue is at a crucial point in time.
I got it right here.
Just got out of the
Look at this guy running video.
Senate. It's not good enough. It doesn't have the public option in it. So anyway, we're here today to bring our voice and power to this National Day of Action. And thousands of Move On members and our allies are rallying in over 100 cities and towns around the country. Who are you with?
We're with ourselves.
Good enough with us.
Okay.
Who are you with?
MoveOn.org.
Hey, I'm with you, man.
Okay.
I've given them money.
Okay, I didn't know what you were doing.
I got the right to be here.
All right. And, you know, we're closer than ever to health care reform. And the next few weeks are critical. The insurance companies and HMOs are spending nearly $5 million a week. I saw an estimate where they spent $380 million over the last 3 months. That's more than $5 million if you figure all of the independent groups that are spending money out there.
Where are they getting that money?
Yeah, that's
From
right.
us?
Out of our pockets, a lot of it, and from the taxpayers. That's where they're getting it. And their top target to defeat is the public health insurance option. And a strong public option is a critical part of this reform. And it's the key to bringing down costs. Senator Webb has not openly supported the public option yet. And that's why we're here. We need him on our side fighting for the public option and for the people. And we're here to encourage him. He is persuadable. We think he is persuadable. We're here to encourage him to start standing up and fighting for this public option at every step of the legislative process. It's in the Senate. It's coming to the floor on a bill is. We'd like him to speak out now before he gets to the floor. And there's a specific thing we're asking him, Senator Webb, to do. Last week, 30 senators has a resolution or a letter initiated by Senators Brown, Feingold, and Rockefeller calling on Senate leaders to include a public option in any health care legislation they bring to the floor. But Senator Webb hasn't signed yet, as far as we know. So we're calling on him to publicly commit to join those 30 senators in fighting for the public option in the Senate bill. In a couple of minutes, you see these boxing gloves here that we're counting on Senator Webb. We have some actual gloves that we're going to deliver to Senator Webb's office in a few minutes to ask him to put them on and start fighting for us. First, though, I'd like to introduce, I know one person is here. Is Linda Paulette here?
I'm right behind you.
Okay, Linda
Okay.
is going to tell us a little bit of how she's been personally affected by the health care crisis. Linda, go ahead.
Thank you so much for coming out. My name's Linda. I'm from Virginia Beach, Virginia, born and raised. In 1999, I did not have any health insurance, and while I was taking a shower, felt a lump in my breast. I was scared to death to seek treatment because I did not have insurance, and so I did not for about 9 months until finally some friends practically drugged me to a free clinic, and I was diagnosed with stage 2B breast cancer. I chose to have a mastectomy because a lumpectomy would have taken so much of my breast off, I still would have been deformed. They removed all 19 of the lymph nodes under my right arm, and 8 of them were cancerous, and so my prognosis was grim. I applied for state and local hospitalization. These funds come from Virginia taxpayers. And I think that is what a lot of people don't understand. I had to have 8 rounds of chemo since my breast cancer was so far advanced. And in that time, in the year 2000, chemo cost over $10,000 per treatment. The state and local hospitalization paid for that as well as my surgery. My 33 treatments of radiation were donated very kindly by the Medical College of EVMS. I would approximate, I don't have the exact figures, but I would say that my breast cancer treatment probably cost between $150,000 and $200,000 when you totaled it all up. And I am here telling my story today to honor all of the people who have died and who have suffered because of the lack of strong health care in this country, which we need so desperately. It is
Hear,
a
hear.
privilege. It is not a privilege. It is a right.
Yeah.
Thank you.
Thank you.
Yay!
Thank you, Linda. Next we have Lori Absher. Lori, where are you?
I'm right
Here. Lori's got her story. Thank you for coming out today, Lori.
Hi there. My name's Lori Asher, and I've never done anything like this before in my life, so I'm a little nervous right now.
You're fine.
I actually wrote it down lest I forgot my name. I am a mother, a daughter, a sister, and a friend. And strangely enough, I'm an unemployed, uninsured breast cancer survivor also. I'm cancer-free as far as I know right now because I don't have the $600 to pay for the every other month blood workups that they want to do. I was also stage 2, not B. Mine hadn't spread too far. God was smiling favorably, and I had some cancer cells just sitting there, not doing anything, so I was good with that. But along with the $600, because I don't have the insurance and that I can't pay for my ongoing anti-cancer meds or anything like that. I'm humbly asking Senator Webb to support public option so I at least have a chance. As it stands right now, insurance companies won't even talk to me until I'm 5 years cancer-free. I'm only 2, so I've got 3 more years of crossing fingers and praying and doing everything that I can so that I'm able to do that. Due to the economic situation at the time and the amount of work that I lost during my treatments, I lost my job. I did have health insurance, though, going through it, but it was an incredible fight every single solitary step of the way. From stupid things like, okay, you can have a Mediport so you can get your cancer drugs, but we're not going to take it out for you because it's nothing essential, that we need to take it out. I was able to pull all of my resources together, and I did COBRA for a few months. But, wow, that can really wipe out a 401k and savings and everything pretty quickly. And so I'm really right now left with nothing. Because of the medical bills and the co-pays and the limits on the drugs and so forth that I needed while I was going through my stuff, I would file bankruptcy right now if I had the money to file bankruptcy, but you need money in order to do that also. So that's another, I don't know, I think the last flaw. So as of right now, I'm in court every couple of months with Centera, trying to get through a staph infection that I got at one of their hospitals, and they're suing me for the cost of that. Many of the complications I had after, breast cancer is multiple hundreds of thousands. I had 7 surgeries after I was finished with my treatment. And one in particular, because of some of the complications I had an open chest wound. And when I contacted my health insurance company, because they had no billing code to classify it, they wouldn't approve it. Well, I was at my office, at my desk, and I've got an open chest wound, like the quarter of the size of my body. And they're trying to say, well, we don't have anything for you to, there's nothing that you can do. Maybe you should go see an urgent care doctor or your family practitioner. I at the time didn't know that was such a thing was even possible unless you were maybe on a battlefield, But with lots of fights and threats, I did finally get some treatment. Of course, now they're keeping me in court for that. In this area, as y'all well know, we have a lot of military, and thank God they've got health insurance. I think the health insurance has to be a right that all of us have, whether we're military, working, non-working, it doesn't matter. It absolutely has to be a right because they are going to pay for it in the long run. And people who have insurance really aren't at all concerned about public option because it doesn't affect them. And I think that we just need to make a really loud stand, and let our voices be heard, because sooner or later they're going to end up having to pay for it also. So if we can do this and maybe get some competition in there, maybe that'll be a a great thing. But I'm happy that the military, that we have so many of, which is great, do have health insurance, but I believe that I have a right to health care also.
Absolutely. Here, here. Absolutely.
What do we want, folks?
Health care.
When do we want it?
Now!
All right. That's exactly why we're here.